When one thinks of workplaces with high levels of worker risk, a number of occupations come to mind. You may envision assembly line workers, law enforcement officers, construction workers, or really any career represented by a member of the village people. And while it is true that these occupations possess inherent risk of injury, none of them has the highest degree of risk. In actuality, nursing assistants are placed at the greatest risk of injury in the form of musculoskeletal disorders and debilitating back injuries in particular. A study performed in 1984 found that back injuries among nursing aides accounted for 3.6% of workers' compensation claims, compared to 3.4% for material handlers and 2.8% for construction workers. These nursing assistants provide assistance to patients with a variety of basic tasks, including dressing, bathing, walking, eating, and using the restroom. Other members of the nursing profession, such as registered nurses and orderlies, also face elevated risk of injury, particularly lower back disorders. Historically, these other nursing professionals have injury incidence rates similar to those of construction workers and garbage collectors, which are some of the highest in the entire workforce. These injuries are costly not only to employers and employees, but also to patients, whose quality of care deteriorates as nursing staff is adversely affected. Research has shown that roughly 60% of back injuries suffered by nursing professionals result in missed work days or job restrictions. The cumulative days missed by injured nurses and nursing assistants also places additional strain on the employees who are not injured, as they inherit additional hours and duties. A great deal of research has been performed to identify the causes of these debilitating injuries and to explore avenues of injury mitigation. Although there are measures that can be taken to protect these workers, they are often not taken, and these injuries have continued to plague nursing professionals around the world. The tasks performed by nursing personnel, and nursing assistants in particular, that have been found to possess the strongest association with lower back injuries are patient transfers. These patient transfers include adjusting a patient in bed, transferring a patient between a bed and a chair, and transfers between a chair and a toilet. The vast majority of nurses are taught some variant of proper body mechanics for the movement of patients, aimed at reducing the risk of injury. Many of the foundational principles of these body mechanics are familiar to those who lift heavy objects. Back straight, bend at the hips and knees, lift with the legs. There are those in the scientific community, however, who question the effectiveness of such mechanics. William Maris, the director of the Spine Research Institute at Ohio State University, argues that there are no mechanics capable of shielding nursing workers from injury when performing patient transfers. He argues that the forces inflicted on the spine during such moves are too great to be compensated for without the use of machinery and equipment.
Maris bases these claims on research he and his colleagues have performed for over a decade, beginning with a study that took place in 1999. In this study, 17 nursing professionals with a wide breadth of experience performed a variety of common patient handling tasks while connected to electromyography sensors. They also used a device invented and patented by Maris called the lumbar motion monitor that worked with these sensors to provide feedback into the forces that act upon the spine during each task. A standard patient was used for each participant, a 50-kilogram female who could not bear her weight but could use her arms and follow basic instructions. This patient represented a best-case scenario. The results of this study were ominous at best. It found that the distance between the patient and handler when the patient was in a bed could not be reduced enough to avoid strain, and that the bending required during bedside lifts also placed stress on the spine and its discs. It also found that lifting patients in teams did not significantly reduce the effects on the spine, as the uneven distribution of the lifts resulted in greater shear forces, the forces acting sideways against the spine. This was an important finding, as often hospitals and nursing homes rely on teams of lifters to move patients at lower levels of perceived risk. It is important to remember that these findings occurred with a light patient at only 50 kilograms or about 110 pounds. Over 70% of adults are now overweight or obese, meaning that in most scenarios, nurses and nursing assistants will in fact be moving significantly heavier patients. There are a number of options at the disposal of medical facilities that can serve to reduce the risk of back injury faced by members of the nursing profession. Mechanical lifts, similar to those used to move heavy components on an assembly line, can be used to move patients and are the most common devices used to this end. Stand aids, sliding sheets, lateral transfer boards, walking belts, and height-adjustable beds can also be used to reduce the strain placed on nursing professionals. Additional studies have found that lift availability and having adequate time to move a patient can significantly lower the possibility of workplace injury in these situations. While these mechanisms significantly reduce the risk of injury, it should be noted that they do not entirely remove the strain placed on nursing employees. Maneuvering devices such as a lift chair still places enough force on the spine to cause injury to spinal discs over time. One of the biggest issues regarding back injuries among nursing professionals is that many medical facilities are not taking the necessary steps to protect these employees. Often these workers are subjected to long working hours with limited access to lifts and other patient transfer equipment. Employers are heavily reliant on proper body mechanics as a primary measure of employee protection, despite the fact that research has placed the merits of such procedures under scrutiny. Not much has materialized in terms of new regulation to protect nursing professionals, even as injury numbers continue to rise. This situation will be a difficult one to address quickly, and employers in the medical field will need to actively seek alternative methods to protect their nurses and nursing assistants. For those who give so much to provide care to others, it is certainly time for them to receive some care in return.